What is the difference between hypothyroid, hyperthyroid, and Hashimoto's? It's so confusing. It's all related to thyroid. That's all I know because I'm not a doctor. But we are going to be talking with Dr. Josh Red. He is just so hang on for 1 second while I pull him in, and you can ask all the questions. He's a chiropractic physician. He is the top Amazon best-selling author on Amazon. He's written a lot of books. Hi there. How are you, Dr. Josh?
Hi, can you hear me?
Yes, absolutely.
Okay, it's a little windy out here, so I just want to make sure.
No, 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 no. It looks beautiful wherever you are.
Yes,
Oh
Hawaii.
my God.
It's great weather. It's a lot better than Utah right now. Where
Absolutely.
it's snowing
Well,
a ton, you know?
yeah, no, no. Welcome so much, everyone. This is Dr. Josh Red. He's a chiropractic physician. He is now Amazon #1 best-selling author. He's a diplomat in functional medicine, American Association of Integrative Medicine. I can go on and on, but we have only 10 minutes. So we are talking about Hashimoto's. You want to add something about yourself, or we just dive right in?
No, I think that's great. Obviously, we see patients that suffer with Hashimoto's really from all over the world. We see probably patients in 30 different countries and every state in the nation right now. So we
30
probably have
different
one of the,
countries? Wow.
yeah, we probably have one of the largest Hashimoto's clinics in the United States. So Hashimoto's is like a sixth child to me. I have 5 children, and Hashimoto's is my sixth. You know,
Is that literally or metaphorically?
a little bit of both, actually. I spend a lot of time doing research when it comes to Hashimoto's specifically. So.
Okay. So just explain us. We have only 10-15 minutes. He's very busy. So just tell us what happens in Hashimoto's.
So here's the biggest thing. When somebody's suffering with low thyroid, the biggest thing that you want to do is identify what's the mechanism behind it, right?
Okay.
You would be shocked at how many individuals have low thyroid and don't know why they have a low thyroid to begin with. And that right there is a huge problem, right?
Yeah.
The most common cause of low thyroid, especially in America, is a disease called Hashimoto's disease, which is an autoimmune disease. So this is a lot bigger, more complicated autoimmune problem, not just a primary thyroid issue. And so a lot of these patients that have low thyroid actually suffer from this bigger, more complicated problem, and they're on a thyroid hormone, but nothing's being done to address the actual autoimmune portion of it. And so these patients typically tend to get worse and worse and worse over time because that bigger, more complicated problem is not being addressed, which is the autoimmune portion of it.
Got it. So autoimmune is, when the cells are attacking, right? That's what it is.
Exactly. Yeah. So what's happening here with these individuals is their immune system, rather than attacking just bacteria and viruses and things like that, becomes a little bit overzealous and starts to attack the thyroid tissue. And then that creates, obviously, a number of issues and a number of problems. That destroys the lining of the tissue, and then the thyroid can't produce the proper thyroid hormones. And that's when a patient will typically be on a thyroid hormone. But then the problem there is that nothing is being done to the actual autoimmune portion. And so the brain, there's so many things that are impacted when it comes to Hashimoto's too. So when you have an autoimmune disease like Hashimoto's, your brain can become really inflamed. You can have intestinal issues. You can have blood sugar imbalances. And then you can just be overwhelmed with inflammatory cytokines and issues like that, right? And so, that's really the biggest thing. And our whole focus is that we want to stop just neglecting the big issue. We want to get to the reason why this fire is going on, and we want to address those triggers that are causing it, to flare up and causing these patients to feel worse. If that makes sense.
Yeah. So, all right. So let's just real quickly go over the tests. So what kind of testing would you do to figure out, what's good? All kind of testing?
Yeah, so here's the thing. So testing specifically for Hashimoto's is really easy.
Okay.
All you have to do is a TPO antibody test, and this is through the blood work. So you'll do a TPO antibody test and what's called an antithyroglobulin antibody test. Really simple and really inexpensive. So if you have low thyroid and you haven't done those tests up to this point, you got to do them, right? It's such an easy test to do, and if that comes back high and you have low thyroid, you would be classified as having Hashimoto's autoimmune low thyroid disease, which is this problem. Now, once you have Hashimoto's low thyroid, there's more tests that we want to do to identify what are other imbalances and triggers, right? And this is where it gets a little bit more complicated. So we can do blood work to check to see how your glucose levels are functioning, to see what your cortisol levels are like, to see what your hormones are like, to see if you have what's called a methylation problem, which is a simple homocysteine issue. But there's certain tests like that in the blood work that we'd want to do if you have Hashimoto's to see exactly what imbalances inside the body are actually triggering this autoimmune response, right?
Yeah.
And once you can identify those simple imbalances and you improve them, the patient's going to feel drastically better, right? But somebody could have cortisol defects, hormonal imbalances, blood sugar issues, intestinal problems. I mean, the list goes on, and those can be imbalances within the body that cause it to trigger. We also know that there's going to be some dietary and lifestyle things that cause it to flare up too, right? So somebody might have, let's say, an intolerance to plastic, and every time they drink their coffee with a plastic lid and BPA goes in the body, their immune system could freak out and cause problems and flare up the actual Hashimoto's. They could be intolerant to something as simple as gluten or dairy. You know, I mean, but here's the key: is every patient's so different. They have different imbalances and different triggers that cause it to flare up, and so it's really important to make sure that you know exactly what your triggers are specifically, and you know how to address them. Right. The easy thing, though, if you're watching this, the easy thing to do is just simply check to see. You know, do a food intolerance test and do an environmental toxin test. We use Cyrix Labs, which is a really popular lab. But at the same time, that's a simple thing that you can do to know what's causing things to flare up. And if you just avoid those inflammatory foods and you avoid those foods or those environmental triggers, that could play a huge role in just simply calming down the autoimmune response, right?
Yeah.
So.
And then replenishing it with the good foods, right? With the good lifestyle and all that. For sure, 100%, right? Here's the thing: we're seeing autoimmune diseases and Hashimoto's skyrocket, right? And unfortunately, females are really the ones that are getting the end of the brunt of this. It's about a 9-to-1 female to male ratio. This is a big problem, and it's just increasing over the last 20 years. And it's going to continue to increase and get worse and worse. In America, we've increased the quantity of our food, and we've drastically decreased the quality of our food. And so pretty much what we're finding out now is that as we develop food intolerances, those food intolerances actually turn into autoimmune conditions. You know, if we keep on eating those foods that are causing problems and our immune system is reacting to them, it can develop really quickly into an autoimmune condition, right? And so making sure that you avoid foods that are poor and bad, that's huge. I guess one of the best ways that we can flare up an autoimmune disease is just by having a patient eat a standard American diet, right? I mean, our food is so bad here. But, you know, if we can avoid things like gluten and dairy, you know, and minimizing the sugars, just that small change can have a huge impact, right? Yeah. No, I think, I mean, at least, you know, we recognize that our food is bad, right? At least, I mean, that is something, you know, a step forward if you think about it. Otherwise, you know, all these years, 20 years back, you know, everybody's eating all kind of like, you know, I don't want to say, but all of a sudden eating processed food and eating out of cans and doing all that things without understanding the impact it's going to have as we age, as we grow older, you know?
Unfortunately, and that's really the biggest problem too. And here's another thing too. Obviously, you genetic with this.
Yeah.
Seeing more people develop this. They're seeing close to percent of the country of autoimmune disease. They have some form of autoimmune reaction which is occurring and creating problems, and that's 20%. There's more people suffering with autoimmune conditions than there are people dying of heart attacks and cancer and things like that. So it's really mind-boggling.
Yeah. All right. So to summarize it, what would be your recommendation to the users? You know, to start with, you talked about the food part of it. What else? I mean, getting themselves testing, right? We talked about that.
So look, everyone's a little bit different. So what I would really focus on if you have low thyroid or Hashimoto's or autoimmune disease, an easy first step is to do what's called a TPO antibody and an anti-thyroglobulin antibody. That's really simple. You do that through the blood work, and any doctor can run that, and it's really, really inexpensive. First, do that. If you have Hashimoto's, at that point, you could do a number of things to see what's going on. You could do a food intolerance test, and you could do an environmental toxin test, and avoid the foods that come back positive, right? Yeah. We use Cyrex Labs. There's a number of doctors that can order that test, and you can find a doctor near you. But just avoiding the foods that come back inflammatory, and avoiding the, minimizing exposure to different environmental toxins, that's so easy that you don't really need a doctor to see, right? Yeah. There's other things that you can do where you can actually check for, or you can increase your vitamin D content. Vitamin D improves what's called the regulatory T cells, which helps dampen the autoimmune response. Something as simple as like turmeric and resveratrol, those dampen Th17 cells, which is really a bad cell for Hashimoto. Somebody's asking a question as far as what were those labs testing in?
Yeah, they were asking about the lab test. You talked about that.
Yeah, so you'll want to do a TPO antibody test. That's just TPO. Antibody test. Yeah. And then do what's called an anti-thyroglobulin antibody. That's a mouthful, but your doctors could easily run those tests. We'll post a lot of stuff on our on my Facebook page, and I'll share that with you as well. Yeah, please. And those that are listening can see that.
Absolutely.
But that's the biggest thing is every patient that we see is so drastically different from one patient to the next. They have different food intolerances, they have different environmental toxins, they have different imbalances within the body that end up flaring things up. And so the critical component is just to see what are your specific triggers. Yeah. And if you can find a doctor that can analyze that for you, it's a game changer. You would be shocked where most of our patients will have anywhere from like 0 to 5 good days a month. They just don't feel like themselves, and they've kind of lost all hope, and they feel terrible. And it's horrible to see, right?
Yeah.
My first patient that really got me to develop a passion for Hashimoto, she had Addison's disease, she had Hashimoto, she had been to so many different doctors, and nobody knew what in the world to do with her. Her son was asked to draw a picture of her at school, and he drew a picture of her in bed. And he brought that home, and she pulled that out, and she's like, "What's this? What's this, son?" And he said, "That's you, mommy, because you're always in bed." And she knew. I mean, she'd been suffering for 20 years, not knowing what to do. She was on a number of medications, and it was really one of my first patients when I walked in. She just said, I'm at the end of my rope. And she told me that story. And, that has always stood out to me as far as like, man, there's so many people suffering like that. There's so many people that don't really know and understand how to get help and what to do. Yeah. And there's really simple strategies that if we can properly educate and teach these patients, they're game changers, and it can help them for the rest of their life. And what we're finding out now is if you have one autoimmune condition, it's likely to turn into other autoimmune conditions. Yes. And so it will minimize so many problems down the road if you can get on top of it right now. We're in the process of doing different research studies. COVID's kind of taken up a lot of our time, but we did a study where we checked to see how many Hashimoto's patients, like what was the most common autoimmune condition linked with Hashimoto's. Mm-hmm. And ironically, I thought it would be like intestinal autoimmunity or, just something. But when it came back and we found that 50% of our Hashimoto's patients had antibodies attacking neurological tissue.
Oh my God.
That's mind-blowing. So here we have these individuals, they get on a thyroid hormone, they kind of get herded around like sheep every 6 months, and they continue to decline and feel worse and worse and worse, and they potentially have antibodies attacking neurological tissue and have no clue, and they're not addressing the triggers that cause the Hashimoto's to flare up, and they're not addressing the different imbalances that cause it to flare up, and these people continue to get worse and worse and worse. And so, like right now, there's simple things that you can do that can save you years and years and years worth of heartache, right, and worth of symptoms.
Well, thank you so much. No, I think this is very helpful. I see quite a few people have joined, and a lot of people will probably watch it after we've done. But just use the simple tips that Dr. Josh is talking about, and can save you years and years of feeling awful and maybe stop having medication. Do you have any patients who've gotten off medications with your functional medicine approach?
Well, there's a lot of our patients are on a number of different medications, right? And a lot of them we work with their doctors and they no longer need their medications. There is something though, if you have a permanent thyroid disease, like if your thyroid is permanently destroyed, those patients aren't getting off the thyroid hormone, right?
Yeah.
And rightfully so. But when you're talking about like statins and blood pressure and glucose and all sorts of other medications, it's amazing what happens when your brain's no longer on fire, when this inflammatory process has finally calmed down, and these people and patients are educated enough so they know what to do and how to control their health long term, right?
Yeah.
And that's really that's our goal that we have for all of our patients, and that's our goal that we have for really spreading awareness for Hashimoto's in general,
Yeah. Well, thank you so much, Dr. Josh, for being with us. I know, Dr. Josh is very busy. I'm so honored and thankful to him for sparing a few minutes. I really wanted people to listen to you, to be able to make you accessible so much so that people learn, maybe they can, help. It helps so many people with your wisdom and tips. Thank you so much.
Well, thanks so much. We'll post a bunch of stuff and I'll send stuff over your way as well so that anyone watching can have it. So
absolutely. I'll add that. Thank you. And
okay, thanks so much. Take care.
Okay, bye-bye.